Hello everyone. This is my first video for data interpretation exam. I've started with the respiratory system. So let's start. Have a look at this picture. In this picture there is a spirometry and peak flow meter. Now peak flow meter is not going to come in data interpretation part. Usually it comes in a practical part. You have to demonstrate to the patient how to use the peak flow meter. Now in data interpretation part, which this video is about, they can ask about FEV1 and FVC. So we will look into it in this video, and we will also discuss the very important part is about management of acute asthma and acute exacerbation of COPD. So a spirometry device, this measures FEV1 and FVC ratio. Okay, so let's have a look at the next slide. Now you need to know what is FEV1 and FVC. Okay, you can read here as well, but basically you ask patient to blow into spirometry device, and they have to blow hard and fast in the device and as long as they can. So in the first second when they blow, usually that device gives you the print of the print, and there is a graph on that device once you complete the spirometry. So in the first second is amount of the air that patient exhale with the force that device measures, and that's called FEV1. And FVC is total volume of air that patient forcefully exhale in one breath. We will look at the graph and you will get better idea. And the most important part is a ratio. Okay, and what you can decide from the ratio. So in exam you will get the value of the FEV1 and FVC, and then you have to decide the ratio. Okay, let's have a look at the next slide. So what ratio is normal? So for individual healthy person, ratio should be more than 70%. Should be more than 70% or equal to 70%. If it's below that, that indicates obstructive pulmonary disease. Obstruction, there is a kind of obstruction. Patient cannot breathe out just like normal adults because their lungs are damaged. And if it's more than 70%, we already discussed. No, more than 70% is normal, but it can also indicate the restrictive pulmonary disease. So how you decide between normal and restrictive if your spirometry results come back more than 70%? So have a look at this graph. You don't need to remember it, but in restrictive pulmonary disease, everything is low. TLC value is low, FEV1, FVC, these values are low. In normal individual, it will be normal. Okay, so we'll look at this slide later. Have a look at this slide, this one first. So in an exam, they usually give the value of FEV1 and FVC. So let's look at one example. So let's say in exam, if they give you value of FEV1 is 1.5 liter and FVC is equal to 3 liter, to give you this value. Now you have to make a decision whether it's obstructive, normal or restrictive. So this ratio indicates 0.5 liter, which is equivalent to 50%. That indicates it's obstructive pulmonary disease, similar to this one. This is a graph of obstructive pulmonary disease. Now you can look at another example here. They can give you these two values. You have to decide about the percentages. So if it's more than 70%, so you don't have to. They might not give you calculator, but you can decide it's more than 70% or not. So like for 1 liter, 70% is like 0.7. For 2 liter, is another 1.4, another, and for half it's like 3.5, so you can add 3.5 in it, so 1.35 something, sorry, 1.75, something like that, for 2.5 liter. This is a 70%. You don't need to be mathematician, but you can roughly know. So it's 2.2 liter, so it's more than 1.75, so you know it's more than 70%. So either it could be normal or restrictive disease. So they might give you normal values, or they might not give you normal values. If they don't give you the normal value, you know that for normal individual male, FEV1 is around 3.5 to 4.5, something like that. So you can get an idea, it's lower than that. Okay, so first you have to calculate the ratio and decide whether it's obstructive or restrictive pulmonary disease. So one question can come up on that one. At the end of this video, I will write down few questions how it can come up in the exam. Now the next one, have a look at this one. So in this one, they can ask you about the examples of the obstructive pulmonary disease. Obstructive. So these are the 4 common ones. You just have to remember COPD and asthma. It's easy to remember these two. Okay. And we will look into this in more detail in our next slide. And here there are some examples of restrictive pulmonary disease. So they can ask, can you give some examples of restrictive pulmonary disease? So here are some examples. Obesity, scoliosis, sarcoidosis, ILD. So you just have to remember that. They won't ask you in more detail. Okay, so now you can have a look at these 2 graphs. It's not important, but just for your information, how to decide the severity of obstructive pulmonary disease. So FEV1 is needed. So if you have FEV1, you can decide whether it's mild, moderate, or severe obstruction. Or for restrictive pulmonary disease, severity is decided by TLC values. So you can have a look at this graph. This is not important, so that's why we are not looking into it too much. Here is a graph. Sometimes they might give you the graph, which is less likely, but if you look at this graph, that will give you an idea. If it comes up in the exam, you know whether it's the graph is for restrictive disease, obstructive, or normal. So you can see patient has been asked to blow into the spirometry device. Patient has started blowing hard and fast, like whoosh. So that's why the graph just gone faster. That's in normal individual. First, second, very hard and fast. Most of the air has been blown out. Then carry on blowing out. So this is the force expiratory volume in 1 second. Usually, as I said, 3.5 to 4.5 in male individual age 20 to 60. Is different for different. It depends on age, ethnicity, sex, and other things. And in obstruction, let's say COPD, the lungs are damaged, so a patient cannot blow out hard and fast. So that's why FEV1 is reduced. So in usually obstructive disease, FEV1 is greatly reduced. That's why your percentages are below 70%. So greatly reduced. And FVC is also reduced, but the value of FEV1 is greatly reduced. You can see here. That's why it's below 70%. In restrictive disease, FEV1 and FVC both are reduced. That's why the ratio comes more than 70%. Okay, so now how will you decide whether it's once your spirometry results come back less than 70%? So how would you know COPD and asthma? This might not come in the exam, but if it's come, then you know. But it's not very difficult to remember. So just once your spirometry results came back as less than 70%, then what you do, you give patient salbutamol like bronchodilator. Okay, wait for 15 to 20 minutes and do the spirometry again. And if FEV1 improves by 12% or more than 200 ml, that means it's asthma. So it's simple to remember. If it's not, then usually it's a COPD. And you have a history of smoking for quite 10-20 years. Okay, so this is a very important one. Management of acute asthma. It can come up in the exam and usually worth around probably 10 marks or something. We will discuss how it can come up after 2 slides. Okay, so you have to, if they ask how will you manage the asthma, so you first, everybody knows, like, you have to give oxygen, then nebulize salbutamol 5 mg. You have to remember the dose here, and you can give every 10 to 15 minutes back to back. In addition, you have to give steroid prednisolone for 5 days. Now you can remember this, like, if patient struggle to swallow or vomiting, you can give IV hydrocortisone. If you don't see any improvement, you can add ipratropium bromide, SAMA, nebulized form with salbutamol. And still patient is not responding to treatment, if life-threatening asthma, you have to involve senior here, and you have to give IV magnesium sulfate 1.2 to 2 gram IV infusion over 20 minutes, and patient is usually transferred to ICU. I will show you how to remember this in the last slide. Easy way to remember. But we will look at the management of acute exacerbation of COPD first. This is also very important. So you start with the oxygen same way, but here you have to remember 24 to 28% via venturi mask, and try to aim 80 to 92%. Otherwise patient can go into respiratory failure. And so oxygen, same way, you have to give like asthma, you have to give bronchodilators, salbutamol plus ipratropium bromide. You can give either only salbutamol, or you can have ipratropium bromide as well. Just remember those: 5 mg for salbutamol and 500 mg for ipratropium bromide via nebulizer. Okay, so you can give every 15 minutes. Okay, and again you have to give steroid in both asthma and COPD for 5 days. And as we discussed, if they can't swallow or vomiting, then you have to give hydrocortisone. Okay, so one thing to remember here is you have to give antibiotic. Usually in COPD, if it's infective exacerbation, you have to give antibiotics. I mean, in exam, if you just write antibiotics, should be fine. You don't have to mention doxycycline, amoxicillin, or macrolide, or other broad spectrum antibiotics. But you can write antibiotics. If you remember, you can write them. It's not going to cause any harm. And still patient is not responding, the next step would be the non-invasive ventilation, but it will be decided by senior, and senior will take care of it. So you have to involve senior here. Okay, so these last two ones are very important in any exam. Okay, so the next question that can they ask? They can ask about what basic investigation you do. So you have to write X-ray, blood's normal, routinely we do, and blood culture, ABG. You can add ECG here as well. Okay, so yeah. So let's have a look how can question come up in your exam. So usually there are 6 scenarios they give you in the exam, and each scenario or each case study worth 20 marks. So for, let's say, if they ask you about FEV1 and FVC ratio, so what they can do is they present you case studies, for example, like patient coming with patient complaining of SOB, wheeze, etc., and they make a full case study, and then they give you a FEV1 value which is like 1.5, and FVC value is like a 3 liter, and they can ask you can you please they can ask what kind of disease with the FEV1 and FVC ratio. So you just have to do you have to find out the ratio and decide whether it's obstructive. So in this case, like we have already discussed, it's obstructive. So that's probably, don't know, they don't give you marks for each question, but usually for each scenarios there are 2-3 questions or 4 questions, so might be 5. Then they further ask you give some examples of obstructive pulmonary diseases we already discussed. So let's say we have to write, like they ask for 2 or 3, COPD, asthma, etc. And then they might ask what kind of investigation would you do for about patient. So that we also discussed, like blood test, ABG, ECG, kind of things. So like FBC, ABG, ECG. So you just write there. Then what they do is they say, for example, after they have given patient salbutamol and patient's FEV1 improved. So what they are just trying to say, this is a case of asthma, and they might ask how would you manage the acute if patient is coming with acute exacerbation. So how would you treat this patient if they are coming with acute asthma? So we already discussed the management. So then you just have to mention all the steps of the management we discussed for the asthma. So yeah, so that's how they ask the question. So that's make up the 20 marks. Okay, so probably that management might worth 8 to 10 marks, and these are all about like 2 to 3 marks, 2 marks, or might be 4 marks, for example. So that's how they make one scenario, and there are like 6 scenarios. So probably you have to spend around 10 minutes per scenarios. Okay, and let's remember the mnemonic for the asthma treatment. Okay, so how would you remember that asthma management? So it's easy. So if you remember, like A here, then S, and instead of 3 here, instead of TH, make it like 3. So 3 times S, and M and A. So A for, instead of O, we just write oxygen like this. 3 times S, so S for salbutamol, or SABA, steroid, and SAMA, which is ipratropium bromide. Okay, and M for magnesium sulfate, we already discussed, and A for admit to ICU. So that's how you remember mnemonic. You can make your own, or if you have seen somewhere else better, then you can remember. This is just my way of remembering this one, easy way. You don't have to remember anything else. Also remember one thing here, there's some sources that you can give theophylline, so you can add the H for theophylline here, but I think they are not much used. I'm not expert on this one, but you can check HSE website and see. I have not seen theophylline there, that's why. Okay, so good luck, and I'm just going to make more videos quickly, as I know the exam will be in June. So hopefully I'll try to make as many videos I can in next 2 weeks. Thanks for watching, and please don't forget to subscribe. Thank you very much.